Well, to look at the week's political and pandemic developments, I'm joined now by two journalists. Laura Stone is a political reporter for the Globe and Mail, and she joins us from Toronto. And Erica Ifill is a columnist for the Hill Times and the co-host of the Bad and Bitchy podcast, and she joins us from Calgary. Both of you, thanks for taking the time.
Hello. Thanks, Martin.
Okay, well, let's start with, both of you in two provinces, Ontario and Alberta, two provinces where we saw this week, it's not new, but we saw really renewed accusations or debate about whether politicians are paying more attention to economics and politics versus public health. Laura, we saw the Auditor General this week in Ontario producing a report. She said that the Chief Medical Officer of Health, Dr. David Williams, wasn't leading the fight against COVID. She got an angry rebuttal from the Premier. Where is that all going in Ontario?
Well, Martin, it was probably one of the most extraordinary responses that we've seen from a premier on one of these reports. Of course, these Auditor General's reports are always digging into the province's finances. It's often a bad news story for the government and a lot of scrutiny in places that the government may not necessarily want the eyes to go. But the way that Premier Doug Ford reacted to this was really quite something, basically telling Auditor General Bonnie Lysyk that she's not a doctor, that she should stick to the books, and basically accusing her of making a series of falsehoods in this report. This report was very damning, Martin. It found that Dr. David Williams, as you mentioned, our Chief Medical Officer of Health here, was not leading the public health response, although she also pointed to a lot of systemic issues in Ontario in terms of emergency management, preparedness, and that role itself that had not been fixed under the previous Liberal governments for the past decades. So it really was kind of a condemnation as well of the system under which Ontario operates. Of course, Premier Ford has come out repeatedly and said he is following Dr. Williams' advice. He is following the public health experts. And, he pointed to the fact that Ontario is doing well, relatively well, compared to the Western provinces, BC and Alberta, as well as Quebec. So he says, look, whatever we're doing, it's working, and we are following this health advice. Where this is going, though, I mean, it kind of dropped under this crazy news cycle that we're under. It kind of dropped off after day one, but we know that the Auditor General is preparing another report to do with spending as well as long-term care in the province.
Okay, I want to ask you, just before I get to Erica, I want to ask you, though, Dr. David Williams himself also said that he felt that the Premier was taking heed and respectfully, paying attention to his recommendations as the highest public health official in the province. That's sort of all. I'm going to get to that in Alberta. So if the person who's sort of mentioned is also saying, no, he feels that he's being listened to by the Premier, where does it go from there?
Well, it's quite an extraordinary moment because there are so many critics of David Williams now in the province, among epidemiologists and others in the health community. So there was this sense that that those voices were trying to undermine him in this role through this report, over the past few months, and so, it's kind of cast doubt, I guess, and the Premier would argue very unrightfully on his character. And the government actually extended his contract into next September, saying that he's done an admirable job leading the province during this time. So they're trying to block out all of these armchair quarterbacks, in the words of Premier Ford, and just plow ahead with what they've been doing.
Okay, Erica, the reason that there's a commonality here in the sense that we saw the similar thing or something exploding around the Chief Medical Officer of Health in Alberta, Dr. Dina Hinshaw, who our viewers know because they watch her every day or every time she gives updates. There was a recorded audio recordings of her comments about a certain amount of frustration. She says they were taken out of context. She says that she's quite offended that she feels the confidence was betrayed, but they seem to suggest her frustration at a Premier and a government that's paying more attention to economic things. What should we make of it there in Alberta?
Well, the county government is driven by ideology first and facts afterwards. This is a government that talks about freedoms and protecting freedoms, but one of their first bills that they passed was to criminalize protests. So, not all freedoms are equal, as we see. This is also a government that has put the quote unquote economy first without actually realizing that the economy is constrained by the pandemic. Once the pandemic is raging and is around, the economy will suffer. They are connected. They are in lock and step. And so this is a premier who has refused still to produce a province-wide mask mandate, which, according to a recent poll, 81% of Albertans want. So I don't think, even though Jason Kenney has said he's done all he can, I don't believe he has. He has actively discouraged Albertans from using the contact tracing app that the feds have rolled out, and has not provided anything of substance that has been able to substitute for that. Contact tracing is abysmal. Mask mandates are mostly municipal. There seems to be a differential in terms of municipal restrictions and provincial restrictions, thereby confusing people more. Communications have been terrible. And Dr. Hinshaw, I do think, has a public health responsibility as a doctor to, instead of towing the party line, to actually take people's health and, you know, the health of the healthcare system into account, and that should be her first priority, which, in my opinion, what the tapes have shown, have not been the first priority.
I guess this raises, though, the issue that we have seen in no province or territory in Canada, and there's never been a public health official, and some legal experts say they can, who has gone beyond and contradicted and imposed their public health orders on an elected government. And it gets back to this debate about who should be running the province. And we heard Premier Kenney say, no, I'm the elected official here.
But the Public Health Act does give Dr. Hinshaw that authority to impose those restrictions as she sees fit. So he may be an elected official, but the law is the law is the law.
Right. Interesting. I think it's something interesting that we're going to track as this pandemic continues to take on strength. I want to ask you, just before we run out of time, the other big event that we're looking forward to, or looking ahead to, is Monday's economic statement, the economic update from Finance Minister and Deputy Prime Minister Chrystia Freeland. She'll be delivering that at about 4 o'clock Eastern Time on Monday. Both of you, just one after the other. What are you watching for? Laura Stone.
Well, I'm definitely looking for an update on the deficit figure and any updates on the spending programs since the summer. We know the Liberals have made some changes to that, and we know that they're expected to target some other hard-hit sectors, such as airline and the tourism sector. So, you know, what are the immediate needs, and then what are the future needs of this country? Because eventually we are going to get out of this. So what are some of those vision programs, and how are they going to implement them, be it, you know, a national childcare program or their push for green jobs? You know, what is the Liberal government's plan once we get out of this COVID-19 mess in order to push this country forward? Okay.
Erica, what will you be watching for on Monday when the Finance Minister rises and talks about the economic update?
Much the same as what Laura said. I'd like to know what the priorities are. So the fall economic update will likely set out suspending priorities for the most immediate things. But my question is this Liberal government going to embark on a program of targeted austerity after the pandemic, to bring those fiscal balances to a certain place?
Okay. Do you think that's very likely? Because Chrystia Freeland has said that as of now, they will spend what it takes to get us through the pandemic. Or are you talking about the longer term?
I'm talking about the longer term. Okay. After all of this spending, governments have a tendency to listen to fiscal hawks and talk about and impose, I'm not saying it's going to be a blanket austerity.
Yeah.
It may be wrapped up in different language, but austerity is austerity.
Yeah, but just where do the cuts come when they, if and when they come?
Exactly.
Okay.
And who do
Cuts
they
or
impact?
taxes, there's only two options.
Yeah, that's it. And that is what, by all suggestions, that's still a way off as we continue to struggle with this pandemic. I want to thank both of you. Have a good and healthy weekend.
Thank you.
Thanks so much.